So what's the real deal with a man and his testosterone levels as he ages? Should he be taking it? Should he be having his blood levels checked routinely? These are questions that I address every single day. And there's a lot of myths regarding checking a man's testosterone levels, when to do so, and when to prescribe testosterone for a man with certain symptoms.
Testosterone is a naturally occurring hormone in the body. These days, advertisements for testosterone therapy are everywhere, and more men than ever are taking testosterone replacement therapy.
So as men age, we all unfortunately experience a slow decline in our testosterone levels starting at about age 30. However, some men have a more pronounced decline in their testosterone levels. Specific symptoms that may be indicative of low testosterone include diminished libido, ED, hot flashes, diminished stamina, depression, irritability.
Testosterone levels decrease naturally as a man gets older. There are also many lifestyle choices that cause testosterone levels to go down even faster.
I see so many men that work long hours, they're stressed out, they may drink a little more alcohol than most people, they're not getting enough exercise, and all these things combined are leading causes of low testosterone.
There are many supplements and medications available that claim to make you look and feel younger. Many of these advertisements found in magazines, online, and on TV are simply too good to be true.
So these days, men are just bombarded in the news by testosterone replacement therapy products.
Have you noticed as you've gotten older that you don't have the energy or strength or sexual performance you had when you were younger? It may just be the low testosterone.
I think that really hits a chord in a lot of males because it questions their masculinity.
But fortunately, I discovered HT higher testosterone.
What you don't hear enough of is that regular exercise, sleep, a healthy diet, and addressing your stress levels, all those things can help improve a man's testosterone levels.
The magic pill really is diet and exercise. The benefits include increased muscle mass, stronger bones, and yes, even higher testosterone levels.
I see a lot of men who want their testosterone level checked because they're having issues with ED. However, it turns out that ED is usually not caused by low testosterone levels, but rather some other cause. In individuals that have had a long-standing history of smoking or high blood pressure or high cholesterol, that's usually going to be the cause of their ED and not low testosterone. Many times, taking testosterone may not even influence ED. Erectile dysfunction frequently is related to a vascular issue. And in fact, for those guys that are under 50 and have ED, we use that as a potential flag that they may have coronary artery disease. In those individuals, it's important to make sure that their blood pressure is fine, their cholesterol levels are adequate, and sometimes we even recommend a stress test to further risk stratify them. So that's why it's important, again, to not go on the internet and not self-prescribe testosterone.
As with any medication, it's important to work with a doctor. Testosterone needs to be monitored and is only available with a prescription. Testosterone boosters advertised online and on TV to men are not regulated. There's no telling what's in them.
One leading misconception is that testosterone is often viewed as a leading cause of fatigue. It turns out that yes, low testosterone levels can contribute to fatigue, but there's many other variables out there that can also cause fatigue.
The most common cause of fatigue is simply not getting enough sleep. Fatigue is also a common symptom for many other illnesses. It's important to discuss fatigue with your primary care provider. For men who have symptoms, checking testosterone levels is easy.
Checking a man's testosterone level is very simple. We recommend that a man has his blood test checked first thing in the morning, preferably at 8 a.m. The reason for this is testosterone levels exhibit a circadian rhythm. So a man's highest readings are going to be first thing in the morning. As the day progresses, they dissipate. Even waiting till 10 a.m. may result in lower levels.
Some advertisements claim that testosterone therapy is simple and safe. The truth is, as with any drug, there are many risks involved.
Androgel. Serious side effects include worsening of an enlarged prostate, possible increased risk of prostate cancer, lower sperm count, swelling of ankles, feet, or body, enlarged or painful breasts, problems breathing during sleep, and blood clots in the legs.
It's easy for one to think that taking testosterone is without any risk, given you see it all over the internet. However, this is a total myth. Testosterone treatment is with risk. Things or adverse consequences of testosterone replacement therapy include fluid retention. It can exacerbate sleep apnea. It can make your blood thicker and cause a higher hematocrit. It can cause or promote prostate disease. So in certain individuals, yes, it's important that they take testosterone, and it is helpful, but we do have to make sure and monitor those individuals to make sure they remain safe.
Everyone wants to perform at the top of their game, but self-medicating is not the way to accomplish it.
There's a lot of folks out there that want the quick fix and want to take a pill or put on some testosterone gel to help out with their fatigue or diminished libido. Beware the next time you stumble across a testosterone ad in a magazine or on the internet, and know that testosterone therapy is not without its attendant risk. Recently, there's been many studies just hammering home the point that regular exercise, a low-fat Mediterranean diet, and a good night's sleep, all those things can help increase a man's testosterone level.
Feeling youthful and well improves every aspect of life. Change in lifestyle happens one step at a time. Eating healthy, sleeping well, and getting regular exercise keeps the body younger longer. The fountain of youth doesn't come in the form of a pill. Lifestyle choices make all the difference.